Um, Brilliant. Okay, thank you everybody for joining and lovely to see you. So this is a there's a lot to cover, update of where we're at with everything. And just to let you know, we are recording this. It will be shared, but only with the others in the consortium. So yeah, just think about that. If you're making comments, hopefully it won't be made publicly available. Right. So this is the agenda for today. I'm just going to go through them in order. So obviously, very pleased to say that we have a 6-month funding extension. I can't say that I've been applying for funding and received it because it's actually a no-cost extension. So we just had an underspend and we were able to get this extended by 6 months. But obviously, this is fantastic. It takes us through to at least the end of next January, hopefully a bit longer, depending on how the spending goes. But yeah, it's been so busy with so much interest in this that it's very much needed. So that's fantastic news. The London policy workshops, you might remember that well, it was actually last week, we were supposed to be going to London to firstly attend Evidence Week in Parliament to promote this work to MPs and peers. And secondly, then run a policy workshop with sort of senior civil servants to, bring this topic to their attention a bit more, but also try and sort of initiate some sort of pharmaceuticals in the environment England group. So that it's been a lot of work, but it's not going to go to waste. Hopefully the general, well, so yeah, I missed that bit. The general election was then called, so this got postponed, and it's likely now to happen in November. But we'll find out hopefully after the general election's taken place. Sorry, excuse me. So yeah, that's the policy workshop. So it's happening, but not yet. So charity plans. So they're coming along quite well. We're pulling together the document that we need to submit to the Charity Commission, and that's the governing document. So to do that, we need to identify a board of trustees and what's called our charitable objects, which is like a kind of terms of reference of what the charity is going to do. So we've been developing these, and we're starting to think about the remit of the charity, and I'll explain in a moment, but this is kind of why it's important really for kind of how we present ourselves and pitch ourselves to people and for when we apply for our initial funding. So the Board of Trustees, we are delighted to have brought some fantastic people to the table already. So obviously Charles and I are on there. Sharon and Fiona from the Consortium. So thank you both so much. Obviously these are kind of legends in the sustainable pharmaceutical in healthcare and sustainable healthcare more broadly. So it's fantastic to have them on our board. And then we've also got Carol Routledge. So Carol is an entrepreneur in residence at the University of Exeter. And she's got, I think it's over 30 years or loads of experience in the pharmaceutical and biotech sectors. And her expertise is in neuroscience and particularly dementia. She's on the board of advisors, I think, for Alzheimer's UK, and she runs a dementia trust fund or something like this, I think. So she's absolutely brilliant to have on board, really nice as well, obviously. Otherwise we wouldn't have had her. And Victoria Robertson, she is commercial and data law specialist. She's a partner at an international law firm called Trowers and Hamlin. She does work with the pharmaceutical sector already. So again, absolutely amazing to have somebody with a legal background, and particularly somebody who's got, already works in this sort of field. And then David Harland, who is an accountant. He's the ex-CEO and I think director of finance, he was at one point, at the Eden Project. So he's got fantastic experience in environmental sort of governance, if you like, of charities. And he also, I think, is a director or some sort of somebody in governance at Cornwall NHS Trust. So, really fantastic board of trustees to take forward and get us going. In terms of the charitable objects, so this is what we've put down. We're trying to keep it focused on what we do, but equally as broad as possible, so that in the future we can, if we want to say not just do health pharmaceuticals but also animal pharmaceuticals, we've got the options of staying broad. So the main three areas, so it's research into pharmaceutical systems and the sustainability and the drivers and solutions, advocacy, so promoting environmental protection or improvement from pharmaceutical pollution impacts, the transition to sustainable supply, use and waste management of pharmaceuticals. And I'm not sure how much education, like direct education, we'd do, but education on pharmaceutical pollution and sustainable supply, use and waste as well. So that's the charitable objects, and that's going to go, we have to set up a bank account, but we'll be submitting all this as soon as possible. Then in terms of the remit, so the remit, like I say, is how do we pitch this to people? I give a lot of presentations and talks on this already, and I kind of trying to say to people that we are not just a think tank, but also a do tank. So the idea is we're helping, forward the thinking about this, bringing people together, strategies, research in this area, but also helping support implementation. So the think and do parts. And again, when we apply for funding, which hopefully will be as soon as we've got registered, we'll start thinking about this very seriously. I think the think activities will be beyond the UK. And I think that's because partly we recognize we don't have the expertise. I'm not sure if this is a niche area or just relatively overlooked area, this whole pharmaceutical pollution niche area issue, but we don't have all the expertise we need within the UK. So if we really want to bring the experts together, we need to go outside the UK. And also what we're doing is got a lot of relevance. Pharmaceutical industry is global as well. This is a global issue. But in terms of our do activities, I think probably that will remain focused, at least to start with, on the UK and human healthcare. But yeah, any feedback is very welcome. This is all just in the sort of the planning at the moment. But we recognise that the consortium, so you guys are kind of the most valuable thing that we have, bringing people from all these different sectors together. And if we start going outside the UK and outside human use at the moment, the size of the consortium is just going to go huge. So it's a very different type of consortium. So we need to think about this and how we take it forward. Any thoughts are very welcome. But that's the plan and the thinking at the moment. So in fact, does anybody have any thoughts on that before I go to the next item? Or if nobody's got anything pressing, Karen.
Hi. Yeah, I mean, it sounds really good. Just what do you think the kind of structure of it would be then, in particular with the role for the consortium? Like, is there like a formal list of people that contribute to this, or how would that work?
Yeah, I mean, that's something I don't know. We need to really think about, how is it going to work? We've got our board of trustees. Are we going to have our advisory committee and then the consortium? We've got, at the minute, we've got an advisory committee, a consortium, working group leads. I think the key is identifying exactly what we want to achieve in the first couple of years, and then move, and obviously in the longer term, and then seeing what's the most effective structure for that. But I think certainly the consortium is at the heart of this, and I have a big list of people who really want to join. So, but we have to keep it manageable. So the answer is I don't know yet, Karen, but that's the next stage. Once we get this registered, and we can really start thinking about it properly.
Thanks.
Thank you. Right. Okay. I'm going to move on, and then we can come back with any big overarching questions afterwards as well. So just to let you know as well, so we've now run 3 think tank events. The healthcare decision making one, which was a closed workshop back in, I think, autumn last year. And then we've had 2 open panel events, one on social prescribing, and one on 2 or 3 weeks ago on sustainable finance initiatives. So this one on sustainable finance that we had was really interesting. Brought up some really important points and useful ways forward. So this report will be coming out hopefully in the next couple of weeks, which it's just with the speakers at the moment to make sure they're happy with what we've written. So that'll be made available. And I think in the next 6 months, then we're thinking we're going to do one more. And so the question is, what topic should we do? And it'll be either another open event, like a 1 hour chat, like we did for the last two, or we could do a closed workshop again, depending on what we think is most relevant. But one of the questions is, how should we communicate pharma pollution to different publics? So I get so many emails all the time about communicating, with questions, communicating pharmaceutical pollution. And I think there's lots of different stakeholders, different publics who, need different messaging. And there's a whole load of ethical questions around this. And as we move forward as a charity, I think communicating it will be so important. So it'd be really nice to discuss this and, start thinking about the sort of questions we need answers to. Another question that I get asked all the time is how, people are kind of saying, oh, we're only just getting our heads around the carbon, and now you're telling us there's all these other issues as well. How can we deal with all these? How can we integrate them and deal with them all together? And I think, people like Rosalie, environmental economist, she knows about this sort of stuff. But how can we do this, and how can we support decision makers to do this? I think that's a really important question. And then this is sort of linked to that is this issue of the NHS moving beyond carbon. So how, should the NHS move beyond carbon? Obviously, I think they should, but how can they? What are the challenges? How can we support them to do that? So yeah, three different topics that come up quite often. I don't know, again, if anybody has any thoughts on priorities for this. If not, no. Okay, so we'll have a think. I guess my favorite is probably the top one, just because I think it'll help inform us for the next stage. But we'll see. Okay, and then so I'm going to mix these up. Actually, I'm just going to blend them. Just give you an update of where we're at with the roadmap paper and publications. This is the main bit of the presentation, really. So the roadmap paper, so the timeline, we were hoping to send you this by the end of July. I am still hoping to have it in a coherent state by the end of July, but there's been so much going on. It might not be, but it will be as soon as possible. So yeah, you will get that as a complete draft, although I'm going to show you some things today that I would really appreciate your feedback on in the meantime. So that's the very vague timeline. The target journal is still Lancet Planetary Health, and the authorship, so it will be, what we're proposing at the moment is anybody who's contributed to workshops or documents will be listed as authors, and anybody else who's sort of supporting just from being in the consortium will be listed in the acknowledgements. We'll have to liaise with the journal to make sure we're allowed to do that, but that's what we're proposing at the moment. And I'll send a list out later on of who we've got listed as, potential authors, and then you can tell me if it's wrong. So that's the proposal for that. In terms of the story, how are we going to tell this story? And I think what my plan is at the moment is I'm planning, and a lot of this is already all coming together. It's just not all in one document. The problem is we've got the problem of pharmaceutical pollution and, the fact that usage isn't sustainable, and we need real world solutions that balance health, economic and environmental needs. So, from the issue of pharmaceutical pollution, that's the paper. But what I'd like to do is weave in some sort of research of sustainability management. And so sort of showing that pharmaceutical usage and pollution is really it epitomizes a complex environmental sustainability issue, in that, it is so important for human health, and it's so economically viable pharmaceuticals are, that, you know, there's lots of short-term benefits. You know, it's a really interesting issue to talk about and look at how we manage this. And sustainability management research says we need a systems approach to these things. We need stakeholder engagement. It needs to be context specific. It needs to be transdisciplinary. You know, all the things that we're doing, that's all based upon, you know, the research says that this is what we need, but it's still not really getting, you know, it's not that successful. You know, our progress isn't. So this is how I'm going to set the scene, if you like, and obviously talk about the issues behind the sustainability of pharmaceutical usage in more detail. This is our first figure that we're going to include in the introduction, which just gives an overview of the sources and sinks of pharmaceutical pollution from UK healthcare. So I'm just going to make this bigger so I can show you. So I don't know if anybody was at the last meeting. This is my kind of 5-year-old drawing that I gave to the graphic designers, and they've made it into this. So to talk you through this, so we have, this is the river here. So we have drinking water is the blue arrows. So it gets treated and then it goes to the different facility, you know, I don't know, buildings, I guess. So you get healthcare facilities, R&D, manufacture and households. So the red is untreated waste that comes from these different establishments. And this goes to a wastewater treatment plant. But sometimes, obviously, during high flow rates or other conditions, it goes straight out into the environment through combined sewer overflows. Also, you get untreated water going into septic tanks, which then sort of diffuses out into the environment. Now, I know some septic tanks nowadays do have treatment, but I think we had a discussion about this and decided that the majority would be considered to be not treated. So we're going to colour this red. If anybody, you know, disagrees strongly, then let us know. So wastewater treatment plants then, so the treated water, which is this sort of pinky purple color, either comes out as effluent, and we know that not all pharmaceuticals are removed from that, or it's used as biosolids in agriculture, and again comes out diffusely into the soils, the pharmaceuticals that are still there. Also, solid waste comes out of households and goes into landfill, where it can leach out into the environment. And then we have the gaseous waste, which is the green sort of asthma inhalers, anesthetic gases from healthcare facilities. And we have incineration of waste from these different routes. Incineration doesn't come from households because in theory, the households have returned them to the healthcare facilities. And then we show exposure of humans and wildlife, food chain. We show monitoring, which we discuss in the figure legend and obviously in the manuscript as well. We've got overseas manufacture and import, and obviously we talk about how a lot of the supply chains are in countries that don't have the wastewater treatment like us. So this is red. And then we have climate change, and we talk about you know, how increasing temperatures might make this sort of dilution, less water for dilution, or increasing flooding might mean more combined sewer overflows. So this is the kind of diagram. What we're going to do is we'd really appreciate feedback on this and another diagram, which I'll show you in a moment. So I've got these and the legends, which we'll share a link to at the end of this the presentation. So if anybody has any, you know, these are in quite a finalized state. So really, we're looking at anything that you kind of like, nah, that's not right, or nah, can't put my name on that paper with that on there. So if there's anything like that, give me a shout. But yeah, hopefully there's nothing too bad here. Okie doke. So that's the first figure. Well, I'll finish the whole thing and then I'll ask you for comments. So that's the background, you know, setting the scene. And then we're talking about the method. So, you know, obviously in the setting the scene, we talked about the need for stakeholder engagement, transdisciplinarity, a context specific. So we've got the UK healthcare as our context. And what I'm proposing is that I think this is quite new, this approach. But but I'm calling it a system segmentation approach. And essentially, I'll explain what I mean. So when people in sustainability management, well, the management of environmental sustainability issues, often they use frameworks. This is a really common one. It's called the DIPSIR framework. So it's drivers, pressures, states, impact, responses. And what this means is if we look at the state, which is in our case, pharmaceutical pollution, and we can look at the impacts, which might be biodiversity loss or antimicrobial resistance, then we sort of work backwards and look at what are the pressures or the human activities that cause this state to arise, and what are the drivers that underlie this. And then people use this to look at what are the responses, what are the solutions, and if you have a solution targeted at further upstream, it's stronger. So that's the typical framework people use, but it gets criticized quite a lot for various reasons. And this is partly what we've done through our working group reports. So when I sent the working group reports out, I don't know if you remember, but there was like flow charts at the top of the process. And what we've done from that is tried to, so this is the pressure. So you see here, we've got the drivers, and then these are all the pressures. So these are the human activities that lead towards the state, which is environmental pollution with pharmaceuticals. And there's the impacts. So we've been mapping out, with your help, all these pressures, so these activities, and we've split them up into supply, use, which is blue, and waste, which is sort of orangey brown. And so each one of these are activities that support that they lead towards environmental pollution of pharmaceuticals. So again, we'll put this on a link so you can have a look through and see what you think afterwards. But each of these as well, we've got this table. Each of these nodes, these activities, we've also been collecting information from you guys, as well as doing our own literature searches. And Matt, the research assistant, has been fabulous in digging stuff out for this. So each node has got a row on the table. Some of them are much more extensive than others, like environmental monitoring, because there's so much regulation around that. It goes into it quite a lot of detail. So we're going to send this diagram and this table out to you all, and ask for your feedback on all of this in the next few weeks, if that's okay. Right, so that's the method. Oh, so that's what we're saying is this DIPSIR approach is really useful for outlining what the activities are and helping people see what the scope of the system is and understand, the activities. But it has limitations in trying to really understand the deep-rooted nature of this complex issue and identify leverage points for change that go deeper than just the low-hanging fruit. So this is the system segmentation approach. So what we're saying is we've looked at the system from our initial work, from the call to action paper where we mapped the system out initially, and we've identified 5 areas, 5 sort of segments of the system, and what we're applying the iceberg model to these 5 different areas, so that we're looking at the breadth of the system and the depth of the system. And these, I don't know if you remember, in the working group workshops, we agreed on summary sentences for each one, and we agreed on summary sentences for the structures, the goals, and the mindset. And I know this is really small, and it's actually still draft, so you don't need to worry about this now. I'll send it when it's ready. But essentially, we're summarizing what the situation is at each level. And then from that, we've then looked into it and identified leverage points for change. And these can be sort of over the whole system across the 5 different working groups. These have been brought together as optimize structures, transform goals, and evolve mindsets. And that's what leads us to our roadmap. So then we have our roadmap, and we'll talk about each of these in turn. And we have 31 leverage points for change across the breadth and the depth of the system. And in terms of, so that's the kind of pharmaceutical pollution issue output, if you like. But then from a research output, we can sort of discuss about how the system segmentation approach helps us to explore both the breadth and the depth of the issue. So the breadth is the connectivity with other sectors and other issues, which again is something in sustainable development. People keep talking about how we need to show connectivity. And then the depth, we're not just looking at the low-hanging fruit, we're hopefully going to come up with strategies that really address the whole thing. So that's the plan. Oh yes, right. So that's the plan for that. So in terms of from you guys, if possible, we're going to send you these two figures with the figure legends in a link, and we'll put it in the chat at the end of this meeting, and I'll send it out an email as well for those who aren't here. If, like I say, if there's anything major, please let me know by email. I'm also going to send this table out. It's actually quite extensive. It's about 12 or 13 pages long. If you could have a look through over the next, I hope 4 weeks is long enough. If anybody needs more time, let me know. Just look at the bits that might be relevant to you. If you look at those nodes on there, and then if you could just read through the information that we've provided and let us know if it's right, first of all, and if there's anything we've missed, or I've got some comments in there as well where I just don't know. Matt and I can't find the answers. So yeah, if you could do that, that would be really helpful. Because it's 12 or 13 pages long, I don't know if it'll be a supplementary table or if it'll be allowed to go in the main document. We'll certainly include a lot of the information in there in the text, but again, we'll see what happens. So that's that. Right. So before I go on to the extra bits, there's only 2 more slides. Does anybody have any pressing questions, or shall I finish this and then we'll come back to it? Right. I tell you what, I'll finish it and then we can come back to the discussion. So I brought this up last time as an accompanying letter. This was an idea of, at the same time that we publish our roadmap, should we write like a little letter to the editor, to one of the, like BMJ or the Lancet, the main Lancet, and with some sort of sexy title like, does the NHS have a drug problem? And we can talk about the pollution issue and maybe like the financial problem about the cost of drugs going up. And we thought we might try and dig out a killer fact to go with this. So something like, how much did NHS England spend on drugs known to pose an ecological risk, in 2022? And we've done some initial digging on this, and even just in primary care, it was about £400 million, 60 million prescriptions. So we've got the secondary care data. We're not sure. It's in very different units. It's like defined daily doses rather than pounds. So we're not sure how we're going to be able to analyze it and whether this is going to all work. But just to let you know, we are progressing the idea of this letter, but depending on time and how the data goes, we're not sure yet whether we're going to do this. And I know there were concerns raised last time about, do we really want the media interest that this might generate? And anyway, so we'll think about this, but just to let you know, this is maybe in the mix. And then finally, we do have this such huge, so valuable, all these comments about, for each of the 31 leverage points, we have tables like this, which talk about the needs and the enablers. And we did talk previously about this could be 5 separate review papers in itself for the 5 different working groups. It could be still. We also think it could be, if we could pull this together as a big review paper and also pick out the research particular bits. I'm pointing my thingy there, but I don't have any idea if that's a research bit. But there's research needs throughout this, and we could pull this together to become the research change agenda. Which anyway, so I don't know yet how we're going to use this information, and it depends on time. But just to let you know, it definitely will get used in some way. And the other thing is, if our roadmap paper, once that's pulled together, we might think, actually, this isn't good enough for Lancet Planetary Health. It's not enough information. maybe we'll have to go through this, and these will have to be annexes to that paper to be able to get it into a like a high profile journal like that. We don't know. So yeah, that's a wait and see. And I'm going to stop sharing and see if anybody's got any questions. Oh, there's some things in the chat I can see. Let me have does anybody want to start talking? Spelling biosolids. Brilliant. Thank you. Okay, brilliant. Oh, right. Jules.
Thanks, Kelly. I'm just wondering when you share the graphic with the nodes, if it's possible to add nodes or merge nodes or split nodes when you share it with us. If maybe I think that some of the nodes should be split or should be merged, or there's a node that's missing potentially.
Which sort of nodes are you talking about?
I haven't really seen
Oh.
all the nodes yet, but I'm just wondering if in the future when you share to us the graphics.
We can. We could, if it was really important, we could ask the designer to do that. I would be pretty reluctant to do that at this stage because he's had to develop like a code to do it all. So if you think it's really important, then we could. So yeah, I guess just send us what you think, and we'll do what we can. Is the answer, if that's all right.
Okay.
Great, thank you, Jules. And then Rosalie, connection between sea and freshwater could be made more clear. Okay, yeah. Sarah's asking about media. Oh, problem is we can't hear Sarah, so I'm not sure. How are you doing on media, Sarah? Can you explain more? She'll have to do it on chat because she can't talk. Does anybody else have any thoughts more broadly on the messaging of the paper? Talking about comms and getting the message over. Yeah, I guess if just to reply to Sarah, I think we do need a strategy. Like once this paper is published, yeah, we said reluctance about the letter to journal. Yeah, because we so the idea is we need some sort of strategy when this comes out, because we hope that it's going to get media interest, and that would be great to kind of manage that. We do, so it'd be great to talk to you, Sarah, about what's the best way of do this, and the letter to the journal similarly. Yeah, what we're going to do. Thank you, Sarah. Anyway, so I will chat to Sarah and I'll get back to you all on that. Jules, have you raised your hand again, or is it? Yeah.
Yeah, just some thoughts on the paper when you listed about stakeholder engagement and transdisciplinarity systems approach. I think there's something missing, and it's just maybe because I'm working on this area right now. I think behavior is something that's missing in the list because most of the practices that's contributing to, for example, pharmaceutical pollution boils down to behavior of the organization or behavior of the system or behavior of individuals or behavior of healthcare practitioners. So I think it should be discussed there as well. It's basically very much connected with systems and context because behavior really depends on the context and the system. And I'm just wondering if you want to kind of like define what stakeholder engagement is, because in some areas, stakeholder engagement means different. For example, in the area that I'm working right now, there's a difference between stakeholder engagement and public engagement, meaning stakeholder are the intermediaries between the public and the decision makers. So if you want to include the public, maybe we need to kind of like specify that, maybe mention public and stakeholder engagement, or we need to define what's the meaning of stakeholder in the paper.
Yeah, thanks, Jules. Yeah, definitely. I think stakeholder engagement usually it's kind of like sort of saying, how can you develop strategies for change without engaging the people? I mean, when in stakeholder management, it's essentially anybody that has it either is influenced by an issue or has an input into an issue. So the public although in public engagement they criticize the word public because there's so many different publics. Yes, so I agree. We'll make sure we define stakeholder engagement. And I think the transdisciplinarity part of that is the fact that we need to bring in the psychologists, the social scientists, the political scientists, I mean, the economists, I know they are kind of social scientists, but, all the different fields, including behavior, absolutely has to be involved in this. So yeah, we will make sure we define this properly, but do check it when it's written and make sure you agree. But brilliant. Thank you very much, Jules. Does anybody else have any thoughts, particularly if you think, do you know what, this is actually a bit rubbish, it could be made better, criticisms about the approach, or yeah, anything at all? Nope. All right. Is everybody happy with it? I really like where this is going. Great, thanks for any feedback's great, They look good. Okay. So people are quiet because it's good. That's good to know. Brilliant. Okay, brilliant. Well, I guess if nobody else, and what about I've got you then, charity and remit and the consortium and role of the consortium moving forwards. Does anybody have any feedback on that about what you guys think the consortium role should be? What should the remit be? Anybody got any thoughts? Oh, Angeliki.
Sorry for being cheeky and not using my digital hand. Is this a good time to discuss how the consortium might relate globally?
Yeah, well, I guess at the moment, we've got all the options are on the table. So yeah, if you've got ideas, then go for it.
Okay, so I've been in the Netherlands for 9 months now, and there's been a lot of action both within academia, but also within the government to address pharmaceutical pollution in a supply chain approach. So they've been working on it since 2017, and there's been assessment of their approach published. So I guess there was I'm only familiar with the Netherlands at the moment. I haven't looked beyond, and I'm part of a water technology center, and they're developing more technical interventions. So there's a lot of implementation and kind of projects put to work at the moment outside of the UK, and there might be an opportunity to have a conversation. I don't know how you would frame it, because as you said, this gets really big if you kind of think about a global consortium. But I think it would be valuable from a UK perspective to engage globally.
Yeah, so actually, Rosalie and Lara, I know Rosalie's here, I don't know if Lara is as well. They're both in the Netherlands. They're in the consortium. So are you working with Caroline Mormond? Is that do you know she's one of the...
I'm not working with her, but I'm directly thinking about that work.
Okay, so yeah, there's a lot going on in the Netherlands in this field, and in other, like Denmark, Sweden, obviously, and I think we've had a lot of interest from people, and I think we definitely need to connect with outside the UK. I mean, I've also got interest from a department in Canada, who are doing sort of similar work, and I think I think the question is, this has to be manageable. We have to have a remit, but then we have to, so how do we manage keeping this manageable, if you like, and I think keeping it focused enough that we can do something useful with a context specific, and then linking that with making it globally relevant and influencing and having influence from global partners. So I think that's the kind of, from a think tank perspective, if we're going to have workshops or events, then we can we definitely need to bring in expertise, and we can talk with other countries. But then in terms of the like if we're going to support, for example, pharmaceuticals in the environment interest group, a policy group or something like that, then that, or develop strategies, that will be probably with the UK government or the English government. Yeah, I don't know. I mean, do you have any thoughts about how we could work with partners in the EU?
I think what you mentioned there in terms of initiatives, for them to work, they have to really take seriously local conditions.
Yeah.
So it's like having a focused approach is necessary, but then you were kind of alluding to these moments in which you had these global conversations. So it's almost thinking about when you're turning outward, and that might be through things like a kind of workshop or some kind of international meeting, or sharing lessons learned from the UK, things like that. I don't think it needs to be necessarily structural, but maybe an objective somewhere is to kind of share what you're learning and what you're doing beyond the UK as part of a global exchange.
Yeah, no, I totally agree. And I think because we've got people like Keith and Fiona who are part of the Sustainable Markets Initiative, they are already working globally. And I see Ross has put something about the BSI, so the British Standards Institution, who are also working internationally. We've got people like Stuart who are AstraZeneca's, pharmaceutical industry is naturally international. So I guess if I put this to these guys, because my feeling is that we can influence, we can, have an opinion and help influence and input into their activities where needed, or they can come to us for expertise. But I don't know. I mean, Keith, Fiona, Stuart, I don't think Courtney's here. I don't know if anybody else is here. Sorry, I can only see 5 people on the top. So anybody that's working very internationally, what do you see the role as this charity being? Like, what use are we to you moving forward?
I think there's a lot to be said for learning by doing. And if we can get the global thinking right and local activity, even if it's only in the UK in the first instance, what you can do is share that learning and foster relationships and partnerships to internationalize that impact.
Yeah.
But do it one system at a time. And if we look at the UK system, that would be the one that's most developed in terms of its systems understanding.
Yeah. Okay. Thanks, Keith. And Fiona, did you want to add to that?
Yeah, I mean, I agree with what Keith just said, and I suppose I would build on the fact that by understanding what other international systems or countries are doing, could then be used to shift the argument of precedent in the UK. So I think there's something about understanding where action is happening elsewhere, because that could be used to leverage action here as well. So I think from my experience of working in national policy and then working internationally as well, that's often useful, because you can say, well, in the Nordic countries or wherever it happens to be, this, that, or the other is happening.
Yeah, thank you. And actually, we are being used in that way a little bit already. So I've been invited to talk to the Danish government. Well, one talk in Denmark and then a government talk afterwards, because they see what we're doing, and they're kind of like, oh, look what they're doing in the UK. We want to try and get our healthcare sector to do it. I didn't quite say that our healthcare sector is not doing this yet. I just said this is all theoretical at the moment, but yeah, it's the approach. Brilliant. Thank you very much. I think Minna, I don't know who's first. Minna?
I think yours is first.
Oh, Jules.
No, you're first. You're first.
Okay then. I was going to say as well, I work across quite a few international spheres in pharmacy, and I think you really need what the USP for this group is when you go in, because at risk of just setting up meetings for the sake of talking, and then it just ends up being multiple talking shops where there's no tangible actions, where your country laws differ and you can't implement whatever other people are doing. It's nice to hear about what they're doing, but you really need to know what's applicable to your own country and how that gets implemented. And I think tangible results always speaks for itself. So where this work I see going is implement it locally, find some success stories, case studies, and then spread that message across, and that will kind of brand this group, if you like, the USP, because just at risk of becoming a talking shop internationally if we branch it out before having seen what the results of the group is.
Yeah, thanks, Minna. I think that's really good advice. And actually, the other part of this, linked to what you're saying, is, you know, there's so many great initiatives already out there, and I don't want to duplicate what anybody's doing. And already I've sort of linked up with Healthcare Without Harm and started connecting with those. Obviously, there's also the Chem Trust, which is a charity working on chemical pollution, and I linked up with them the other day, and just to make sure that, you know, I hate the idea of us duplicating energy and effort, and they're really focused on more forever chemicals at the moment, industrial pollution. So, you know, I think by staying in the UK as well, or not staying in the UK, but, you know, our focus is UK based. I think we're not treading on anyone's toes, and we can then more effectively, hopefully, work with people rather than, you know, duplicating. Well, that's what I'm thinking anyway. But brilliant. Thank you, Jules.
Yes, thank you. In terms of how relevant, for example, the work of Pharma Pollution Hub in the context of other countries, there's a movement now, or there's some exploratory work about what sustainable healthcare means in low-income countries. And I think that's something that the work of, like, the expertise in the room could really contribute on. Like, for example, there's investigation on how healthcare systems in other countries could potentially shift to a more sustainable, or like climate smart systems, where pharmaceutical pollution is also discussed, but it's not being really explored because, as Angelique mentioned, it really depends on the context of the healthcare system. Like, for example, in some countries without access to medicine, for example, or even without access to doctors, for example, how would you communicate sustainable healthcare to them when they don't have access to healthcare anyway? There's some, I think the Lancet Commission on Sustainable Healthcare is actually calling for some case studies. And I think this, you know, the work that Pharma Pollution is doing, the Pharma Pollution Hub is doing, could be a case study on how, you know, transdisciplinarity or like multi-stakeholder involvement could really work on that. I'm going to share the link. I think the deadline for the submission is August 31, and it's just about a case study, for example. It's also good for optics because it's going to be published or shared within the Lancet system.
Yeah, okay, thanks, Jules. I mean, does anybody with experience in this, if we're publishing something like this, I don't know how big a case study needs to be, would this have more impact as a case study if it's for the Lancet Commission on Sustainable Healthcare rather than something to Lancet Planetary Health? Does anybody know enough about this?
I don't, but I also think one of the questions could be, if you're a case study, sometimes they appear, don't they, in a little box.
Right, okay.
You know, so that it's kind of so-and-so's doing whatever.
Okay.
So you might want to think about both, not neither or.
Okay, all right. So I'll look in. Anyway, thanks for the link, Jules. I'll look into it. I mean, it could just be that the actual hub itself, which maybe is what you were suggesting, rather than the whole paper.
Yes.
Oh, okay.
It's the hub itself.
Yeah. Okay. All right. Thanks, Jules. I will definitely look into that. Fabulous. There was something else that I was going to say while I'll think about that whilst Rosalie, what was your comment?
I have a question on the UK focus. So when we say it's like UK focus, would we only look at the pollution in the UK, or would we also look at the pollution that is induced by the supply chain? Because the supply chain of pharmaceuticals is global. And I think that somehow, if we would neglect that, we would kind of also, neglect the geography of these issues more generally. So I was like a bit confused how we would actually how the scope would be. And also, I don't know if the UK is producing a lot of pharmaceuticals. Then the question would also be if there's like downstream like exports of pharmaceuticals from the UK. I mean, it's like this production consumption perspective that you sometimes have in environmental accounting, and I was wondering how we're going to handle that.
Yeah, thank you. That's a good point. And actually that helped me remind me what I was going to say, following on from Jules's point. I think this idea of low and middle income countries, our global footprint, if you like, from my perspective, I think, we're looking at the UK, but we do have a global footprint, both upstream and downstream of our usage. And so I've done some work on aquaculture in Bangladesh, and I see that the situation over there is very different. And, it's a whole other load of drivers and communication messages. But what there isn't enough of is people like the UK, countries like the UK, taking responsibility and for that and finding solutions. So I think the UK needs to look at accept that we have these international footprints, and what can we do about it, or what should we be doing about it from our perspective. So obviously we can work in low middle income countries or with supply chain countries, but actually I think the UK needs to bring into our policy and our public sphere the fact that we're not doing anything to address this, and what can we do about it. So I see our role definitely as the supply chains upstream and downstream use, pollution, but within the context of what the UK should be doing about it. But I'm very open. I don't know if anybody else has got any thoughts about that. I mean, Rosalie, do you want to reply to that before I go to Karen?
Maybe super briefly, but I think that in a way, or I think in terms of feasibility, I think it could be very helpful to map out that these impacts are not tracked or something like this. Like if we go in that direction, because I think if we would really model globally these impact pathways, would be super tricky, or that's at least, yeah. I mean, I'm not the pharmaceutical modeler. Lara is the pharmaceutical modeler, but my feeling is that that could be very, very tricky. And also the supply chain is super tricky to track. So it could also be something to make a point about transparency, to say like we actually want to know where these drugs are produced and how the waste streams are treated, and where this pollution is going.
Yeah,
because I do feel that I think, and this also connects to the justice issue that some people have mentioned, that it could even be that some people like just get the pollution but don't get the access to the medicines.
Yeah. I mean, I definitely want to include this in the paper, the social inequalities of all this. Yeah, brilliant. And I agree. And I love an idea of mapping global impacts of UK healthcare. That would, yeah. Oh, I like that. Cool. Brilliant. Thank you very much, Rosalie. Karen, I think you were next.
Yeah, I just wanted to say, I think it is a really, really interesting and big topic, and I completely acknowledge the complexities that Stuart is mentioning. And but I wondered if this could maybe like a specific focus group in the think tank or the Think and Do tank that that considers this as a global justice issue, a social environmental justice issue.
Yeah,
and it'd be interesting to be involved if that was the case, because it kind of brings together two strands of my work that are quite separate at the moment. So
yeah, I think that's a really good point. I mean, I guess as I'm starting to think about this, I know that I'm being very ambitious here. Like we have no money at the moment for apart from another 6 months. And I'm thinking, oh, this is going to be, we can have a consortium for this, or we can have, subgroups for these different topics like sustainable finance. Clearly, we really need one that looks at that as well. There's different aspects of this. We could easily have committees, but of course, this all needs funding and managing. And so I guess I love this idea of having this huge, big, organization that, well, I'd say huge, big. It doesn't have to be that big, but just time to manage it. So definitely it's a definite option. We just have to get the money to make it work first of all. But yes, brilliant. Thank you, Karen. And then lastly, because it's 3 minutes left, Jules.
Yeah, just last thing for me, I think there's really an opportunity to have a low middle income country perspective on this, because even the National Academy for Social Prescribing is now looking into how they can support low middle income country in developing social prescribing intervention, which basically is an opportunity to start talking about pharmaceutical pollution and how social prescribing could be used as a way to reduce pharmaceutical pollution in these countries as well. Their latest global report actually had a section on low middle income countries as well.
Yeah, thanks, Jules. I mean, it's such a massive topic. I think the plan is, let's get the charity registered. Let's get some money in for the basics, so to cover the what I'm calling the core activities, which are probably going to be things like public, making our website so it's really accessible, running basic events, keeping going with the think tank workshops. That's the kind of the bread and butter, if you like, and then these additional things as we grow. But we need to establish, first of all, where the money's coming in, if you like. Are we going to be able to get money from industry in the future to, into some sort of trust fund or something? Are we going to rely on charitable grants? Are we going to get commissions to do reports? I don't know. This is all stuff we kind of need to figure out. So, but yeah, I definitely, I think there's people like you guys who are very enthusiastic and capable and would be able to sort of take those working groups or whatever and do that. So yeah, fantastic. Thank you. Does anybody, we've got 1 minute left. I presume there's no pressing questions, else people would have already put their hands up. So I'll stop then. Thank you very much, everybody, for listening and giving me your thoughts. And I haven't kept up with the chat, so I'll go and look at all that now. Oh, and there's Matt's just put the link for the Canva for the figures in. Thanks, Matt. So if you click on that, you should be able to see the figure with the proposed legend. Yeah, so just email me with any comments about that. Brilliant. Okay, thank you very much, everyone. See you soon.
Bye.
Bye, thank you.
Oh, just seeing how red I am, Matt. I'm like bright pink. Hi, Sarah. Oh, sorry, Sarah, that we didn't get to